Hey, everybody. Hope you are having a good beginning of the week. Let's go ahead and go right into Q&A. So questions, anything goes. You can unmute yourself or type in.
Hey, Greg.
Hey.
It's Robin.
Hey, Robin.
Hi there. We still have to have a chat.
I thought it was Heidi.
I know, our voices are so alike. I have a friend I spoke to this week who has long-term COVID.
Oh,
and
okay.
She's had it from the very beginning, and she's super sensitive. Like in human design, she's called a reflector. It's like she takes in the energy of the environment and super sensitive. And she's like having fevers of like 102, exhaustion.
Oh, wow.
Yeah, it's crazy. It's just crazy. And I just
how long has that been going on?
Well, she's had it since the beginning. She got COVID at the very beginning.
Oh, it's been going on like 18 months?
Yeah, but the fevers and stuff have really happened in the last 6 months, have activated.
Wow.
Yeah, no, she has to sleep 12 hours a day. She's super sensitive. Like she's one of those kind of high beings, very delicate, powerful, spiritually very awake.
Is there body aches and things like that?
Yep, body aches.
What's the respiratory system like, the respiratory tract? Is she having difficulty breathing, heaviness in the chest, anything like that? Or
I don't remember her saying that. I'll have to ask. But it's mostly the fevers, I think, and exhaustion, and yeah. She just started a heavy duty protocol. Apparently she's in a experimental kind of protocol, and they've looked at people with long COVID, and it looks like the markers look like someone with mold poisoning of
mold poisoning?
Yeah, of long-term COVID. And she actually has had mold poisoning before, but that's what the markers apparently are looking like, which I thought was interesting.
Wow, 18 months. The fevers are alarming. It doesn't mean it's life-threatening, but that means that, something's throwing the system off, but most likely she has an infection somewhere. And it could be like a bacterial infection, but boy, viruses don't usually last a super long time unless it's things that just are always in the body. Like there's like the chicken pox and that kind of thing, that kind of virus will stay in the body. But like things like this, usually, wow, fevers like that makes me also concerned for the liver. Sometimes the liver, if it's not functioning well, can start to have, it's usually a little bit more low-grade fevers. It's not quite that high. That's kind of a high fever. And so it's similar to mold poisoning, you say?
That's what the markers are showing, yeah.
Let me look something up here. I think that one of those things we'll have to do is like kind of experiment a little bit. I hate to say that about how to treat this, but it's not. Give me another second here. Well, okay, this is what I would say. And wow. I'm going to have to sit with this a little bit, but I'm going to say some things right now, but you might even get an email from me like in, a few hours later tonight or something where, as I sit and think about this. But one of the things that you would look at is anytime that there's like a chronic infection, usually it's more low-grade infections. One of the best things you can use is Moroccan thyme. And, Moroccan thyme is, we kind of traditionally use it for issues that have to do with autoimmune issues. But one of the things that it's also known for is chronic infections. It's also very anti-inflammatory, and with somebody having fevers for that long a period of time, their body is probably just so inflamed, it's just crazy. And so that would manifest like achy joints, lack of muscle tone, fuzzy thinking, things like that. Even some skin issues, you know, because the body is trying to process the inflammation. And so there's the viral component, and then there's the inflammatory component. And so I would say, you know, the inflammation, black cumin is always good for something like this. And frankincense is very good about cleaning up the inflammatory material and the precursors to inflammation. It's also good for some pain management, because she's probably not super comfortable given that this condition's been going on so long. Then the issue of the infection, Moroccan thyme would be probably something I would start with. She would have to take it internal. It would be a couple drops at a time in water. You know, I'd start with maybe just once a day, and then eventually move up to twice a day. The thing that you can use to treat molds is they're usually really hot oils. And so given the nature of her fever, I don't know that I'd go down the route of some of those hot oils, like just regular thyme, oregano, cinnamon, savory. You know, all these are hot oils that are very good for treating molds and candida. The one oil that doesn't generate heat and could help reduce the mold issue, if that's, you know, like you're saying, there's some markers there. It does stimulate the immune system, is tea tree. And she doesn't have any autoimmune issues that we're aware of.
She well could. She had very bad.
Ask her before we start doing treatment. The Moroccan thyme is okay, but some of the other things might be a little too much for her. But tea tree is really good. The other thing that I would say is Naoli, which is in the tea tree family. So not neroli, Naoli, like Niaouli. Really good for strengthening the immune system and strengthening the immune system very quickly. You know, good for allergies, good for infections, good for immune systems that have just been worn down, and it's not going to generate a lot of heat. The other thing is things like Ravensara, like Ravensara, you know, because there's two that kind of sound the same. So Ravensara, and bay laurel would be super good, super antiviral. I like the bay laurel for this situation, just because if it is a secondary bacterial infection, which I'm sure they probably have tested for, but still it's super antiviral and it's super antibacterial. And so really good one to use in that situation. As a little bit of time goes by, it could be augmented with like thyme thuyonol or thyme geranol, which is a very gentle form of thyme, really good for its antiviral and antibacterial activities without like the heat of normal thyme. Usually you use something like thyme thuyonol, geranol also for longer term treatment, just because it's easier on the system, and you could even put that on the skin. It's gentle enough to go on the skin and should be okay. You know, something like cinnamon, savory, I mean, there are strong immune stimulants. But honestly, with that kind of fever and stuff, I would be a little bit wary about that. Some ginger tea would be good, or yarrow, taking yarrow internally, or yarrow tea. People usually don't like the taste of yarrow tea, but you can get capsules, or you could do the same with the ginger. I'd like her to do ginger tea instead, if she could. And the reason being, for one, it stimulates the immune system, but the tea will have like a diaphoretic effect and will make her perspire a little bit, which will lower her fevers. And so, I mean, there's times where the body just gets thrown out of whack and can start having fevers. I mean, the things that I've seen, that's usually like liver related. If it's not an infection, there's something off with the liver. It could be it could be other things too, but I mean, I wouldn't explore the liver thing until these other things are kind of addressed. But eventually the thing that gets used the most for these intermittent fevers that are liver based, there is not an oil that would work for that, but there is an herb called vervain, blue vervain, and really, really super good for knocking out these like kind of on and off, again, fevers that are related to liver function. And so, let's start with the Moroccan thyme, and
all right.
Let's see if she has an autoimmune issue too. Why don't you email us and see if she has an autoimmune thing, and I'll write out the things to kind of do, and we won't overwhelm her with a bunch of things. We'll just kind of go a little few steps at a time. But boy, we've got to get her comfortable and getting some quality of life back. Like that's got to be just beyond miserable. So the things that I would be concerned about, like as precursors, is, does she have an autoimmune issue? Does she have chronic fatigue syndrome, fibromyalgia, Epstein-Barr, Lyme disease, anything like that, that is a precursor to having a lot of inflammation in the body, a lot of fatigue, and weakened immune responses. And then from there, we can go through and make a treatment strategy. But yeah, I mean, that one, it's going to be hard just to say do XYZ. We might have to like treat and then reevaluate and treat and reevaluate. I mean, that's a serious issue. I mean, that's man. I've definitely been hearing like cases where respiratory functions off for a while. Like my sister, I think it was about a year of having difficulty with her breathing after COVID, and eventually it got better, but she didn't really treat it very much. She just was on oxygen for a while, but had she done some treatment, it probably would have gone away faster. And then people having headaches afterwards. It's usually respiratory issues or headaches. Having fevers that long, boy, that's kind of red alert. Yeah, that's something's up. There's times where there can be like autonomic disturbances where the involuntary part of the nervous system is just like so out of whack. Things like tarragon and anise can be very helpful to balancing those things out. Rosemary, verbena is a good balancer for the endocrine system. But let's get some more information, and I'm glad to write something up for you. And is she there in Hawaii, or
where she is? She's here.
Yeah. Okay. Well, let's get some information, and we'll kind of go from there. And it's kind of one of those things that we can all learn from treating this, because there are people that are having post-COVID issues, but this has been the most extreme one that I've heard. Yeah, that's the fevers, boy. That's crazy. And it sounds like it's escalating. So, I mean, something's up.
Yeah, definitely.
Yeah. So get that information when you can, and get it to us, and we can even, I'll have Samantha send the information as quickly as we can.
Yeah, and I was talking about you, and she might end up coming to a class or something, so you could actually meet her. So
Okay.
Thank you.
Yeah, boy.
For everything.
Yeah, please keep me posted on that. Like, I'm kind of worried about her.
Okay.
That's alarming.
Okay.
Yeah.
Thank you.
You're so welcome.
Go ahead, Paula.
Hey, Paula. I was looking for you last Tuesday.
Let me see about finding you here, and we'll see about. I put a little message so you can unmute yourself. Do you see that?
How are we?
Perfect.
Hey, there we go.
Hi. I'm sorry I missed last Tuesday.
No, that's okay.
We just couldn't make it. I have my my colleague here who's actually a patient of mine also, and
okay.
we've been working together for many years, and she has quite the health journey and story. But today what we talk about is she is a cancer survivor. She had
what kind of cancer?
B-cell lymphoma.
Okay. And how long ago?
I'm 1.5 years outside of treatment.
Okay.
Like a traditional,
Yeah,
all the chemo and stuff.
right.
And so it's sort of knocked her into menopause. Also, right after the chemo, she was diagnosed with Hashimoto's. And now she's been diagnosed with hypothyroidism. So her body is pinging back and forth after this chemo. But underlying all of this, Maestro Greg, is she's had this what would we call it?
Well, I had a neuro event, I call it, in 2013. That was much worse than the cancer. But because it doesn't have a name, people can't really see what that was like. But that almost killed me, that neuro event.
So explain what happened.
I woke up with a headache, the worst headache I had ever had. And then I started to, it looked like seizures, kind of. My blood pressure was, very high. No one knew what was going on. They thought maybe I had Guillain-Barré. They thought maybe I had West Nile, Lyme, they looked for all these things and didn't find any of that. They eventually, through biopsy, diagnosed me with something they called small fiber autonomic insufficiency, which that really didn't explain the whole story of what happened. And eventually I just stayed home to die, but then I didn't die. And then I spent about 2 years recovering from that. And then about 6 years later, I got the lymphoma. But I have a lot of autoimmune diagnosis: Sjogren's, Behçet's, the Hashimoto's now.
Yeah. And you had the Sjogren's before the chemo?
I've never tested positive for it, but my rheumatologist suspected that I had it. And then, the B-cell lymphoma, I guess, is like the highest manifestation of the Sjogren's. Right. But I don't really have any other daily symptoms of the Sjogren's, and I've never taken treatment for any of my autoimmune disease. I don't take any of the treatments for any of those.
Okay. So dry mouth, dry eyes, things like that?
No. Okay. That's why my rheumatologist said, I think you have that. And I go, I don't think I have that. But he's like, I think you have that. So I don't know.
Okay.
Maestro Greg, I wanted to add, just as the practitioner with the Chinese medicine perspective, you know, there is a liver blood deficiency.
Yeah.
And she has this sort of what we call this husband-wife presentation where the left side is completely deficient. They're really, you can't even feel the blood in the vessel there at the radial pulse. The right side is more vigorous. And that she hasn't really presented with anything other than that pulse presentation, which is basically vacuous on the left and present on the right for years and years and years. Now today, she did get a little bit of a pulse on the left, and she's actually experiencing a lot more pain and discomfort and weakness on the right. So it's almost like these things are like the body's getting tired and it's flipping things. I don't
Yeah,
know.
Usually when things are bouncing around like that, there's a depletion in the vagus nerve, and the parasympathetic activity is usually depleted. And so, you know, she has a diagnosis of some autonomic issue. It's probably a little bit of an imbalance between the sympathetic and parasympathetic, which, given everything that she's been through, and given either it was seizure or pseudo seizure, you know, whatever it was that it happened. Did they ever do like any work on checking your brain to see if it was seizures?
They did, and they said they did not diagnose me with epilepsy, but I did have an abnormal reading, and I had spikes in my theta waves. I had abnormal spikes in my theta waves, okay. but it wasn't epilepsy. So.
And nausea, diarrhea, things like that?
No, not generally nauseous. I alternate between constipation and diarrhea. When I had the neuro event, I became incontinent. I was posturally incontinent.
Okay. And have you ever just kind of like fallen for no reason? Like you're just standing there and all of a sudden your legs kind of give out and you fall?
No, only when I had the neuro event.
Okay. And this is a weird question, but has your handwriting changed over the last few years?
Not that I've noticed.
Okay.
I mean, everything's changed, so I don't know.
Yeah.
Okay. My whole personality, you know, I'm talking about this very medically, but also I have this conception, you know, the darkness is after me, and it just keeps coming.
Yeah, Paula, I think probably the best thing we should do is probably have a phone conversation about this.
Okay.
Yeah, there's a couple of things that, like, I would say are a little bit of a thing that I'd like to explore, and like some areas of concern, but you know, the combination of the issues with the autonomic function, and you know, I'm sure there's tons of inflammation because of the autoimmune issues and everything, and autoimmune. Yeah, we'll schedule a time with you, Paula, just that we can all talk, and
that sounds good.
Get that on the books, and so that, you know, both you and what's your name again?
Mac.
Okay, Mac. So when you and Mac can maybe have a, you know, we can do a three-way call or something.
I would love that. And in the meantime, we've been working with your oils, and so you know, and we enjoy that, and you know, so
well, there's things that we could do for the thyroid. There's things that could be done, but the autonomic thing throws it off a little bit, and then the level and degree of the autoimmune issues, we'll have to be very strategic about what we do.
Okay.
And so we'll set up a strategy and everything. We'll do it with a conversation, and we'll kind of go from there. And so if you guys are available, let's do it in the next day or two.
That
And
sounds
so
great.
why
We'll
don't we
make our,
just jump right on it. Yeah. Yeah.
we'll make ourselves available.
Yeah. And
Thank
so,
you.
yeah, we'll work with your schedule. I mean, I have some meetings and stuff, but I can be a little bit
And
flexible.
I'm super flexible too, because this
Yeah.
is so important. Thank you so
Yeah,
much.
like that's Sjogren's. You know, Sjogren's used to not be diagnosed very much. You know, many years ago, there was only like maybe 100 people in the country that have been diagnosed, and then over a period of time, it started getting diagnosed much earlier. You know, than it used to. But a lot of times, where you see Sjogren's is post chemo, and so. You know, it sounds like you had it probably, or at least the beginnings of it prior. And I mean, that one just by itself is a little bit of a handful, but you have several autoimmune issues. And so I think we need to look at it from a broad approach, and definitely need to get the autonomic nervous system functioning better. I suspect what you probably had is what they call a pseudo seizure, which is pretty much just like a seizure, but you don't have the event in the brain. You know, it's basically, it's happening in the body. A lot of times it can happen like when the body gets toxic, like backed up lymph, like the lymphatic system is really stagnant, or you know, liver or kidney function isn't as high as it should, and you'll have like kind of these like pseudo seizures, but just as hard on the body. It's just it lacks the brain event, and so you know, it still could be something else. There's a thing that I mean, it could even have been what they call sympathetic dystonia. I mean, it possibly be, but it doesn't usually last in as bad as what you were saying. Like it could be a really bad case of it, but usually it's an event and the person shakes it off in a couple of days. Like it's not something that is as bad as what you're describing. And so I think it's just a little bit more complicated. So like, you know, we'll figure out, we'll have a conversation and get on it like in the next.
Sounds great.
So yeah.
Thank you so much.
You're
Thank
so
you.
welcome. Yeah.
Thank you.
Yeah.
And go ahead, Chris.
Hey, Chris.
I think it took you by surprise there. I thought I called on you so fast.
Okay, there we go. Now I'm muted.
Yeah.
Figured it out.
Hey, Chris.
Hey, Greg, how are you? Hi, Sam.
I'm doing good. Hey.
Greg, I just wanted to give you an update. I know it's been a while since I came on, but just a quick update. Had the steroid injection on the left hip on August 28th. It was Kenalog. So it took about 2 weeks for it to really kick in.
And what they do, cortisone, or what did they do?
Yeah, Kenalog is a version of the cortisone.
Okay.
So they injected it right into the ball of the hip, and it took about 2 weeks. After about 2 weeks, started feeling some really good relief in the hip, but also during the meantime and since then, been using the oil protocols that we talked about. But what I really wanted to share with you is Chris attended your class on Saturday, so I sat in, I did the Moses technique, and I can't remember if I learned that way back when I attended the class in person with you in Bellevue, but I sat down and I did it with her, and she just handed me, and I don't believe it's by coincidence, the frankincense vital.
Right.
And I did the Moses protocol, and in no lie, Greg, I want to say I was 99% pain-free for about 48 hours. And that's even like a little bit of a, you know, and that's just maybe feeling a little bit of a twinge, you know. Now I don't want to even say it's a 1, which is kind of that bone rubbing on the bone, but I wanted to share that with you that, I don't know if it's the oil.
And remind me, you are,
protocol.
Your issue is bone on bone, or is there a little cartilage left?
There's nothing left.
There's nothing left. Yeah, so very good. Like frankincense, I would say, through the skin, and you can even put a couple of drops in water, because I mean, the thing that you're really battling now is just the bone on bone is going to generate inflammatory material. It's going to generate the precursors to inflammation and some inflammation. And so the better you get at managing it, the more that can stay mobile and not cause any sort of systemic issue. Kind of what happens is, you might be okay for a little while and it's in that area, but at some point, if you're not actively maintaining it, the inflammation, basically it's just like inflammatory material starts to spread to other parts of your body, and all of a sudden, like, all your joints will start aching, and it's just inflammatory material and super backed up lymph. And so frankincense internally, black cumin internally is a 1-2 punch. I would probably take them separately, just so you get maximum benefit from the frankincense and the black cumin. I mean, you can take them together, but the frankincense can do something on its own that when combined with black cumin, it doesn't always do. And so, you could take them 15-20 minutes apart or something, or one in the morning, one at night. Definitely keep putting that joint relief on the area. And the issue with that is you're keeping blood moving through the area. So you're getting fresh blood to the area, and you're also getting the blood to leave, and sometimes what starts to happen is blood will start to stagnate in the area, and then that doesn't allow for more fresh blood to come in, and it starts a little bit of a downward spiral. But keeping spasms out of that joint is number one, and just keeping lymphatic movement going. There is an herb. I might have already mentioned this to you, so if I'm being redundant, but there's if you go online on Amazon, there's an herb called blue flag. And like, I take 2 or 3 capsules at least once a day. You could take it twice a day. But the thing with blue flag is you're augmenting what you're doing by increasing movement in the lymphatic system. And the thing they used to say in the old writings, the old herbal books, is like, blue flag is it produces spontaneous lymphatic movement. And what starts to happen when you have like an area that's like bone on bone like this is the lymph starts getting more and more stagnant, and it doesn't quite detoxify in that area, which just means inflammatory builds up. And so in the old days, the issue was people would get thrown off horses, and then they would injure the hip, and then they would basically have an arthritic hip that was basically bone on bone. And, in the old days, that meant just basically you were bedridden. And what they would do is they would give them large dosages of blue flag, and they could get up and have normal everyday life. They could have normal movement and everything, because there wasn't surgeries back then. And so, I think it's very, very treatable, with it being bone on bone, probably easier on the exercises like running, and something that's really super repetitive, like cycling or something. I mean, you can still do it, maybe just not as much. And if you want to exercise, you could do like swimming and things like that. But, if you're still going to do those exercises, just do a little extra effort of maintaining or decreasing the inflammation after the fact. And you should be able to stay pretty functional for a very long time. Pain is a bit of an indicator there. And we're playing around with different things to address overstimulated nerve endings and just the body's threshold for pain. And so, some preliminary things, we're probably going to be putting them on the site here pretty quick, but the preliminary look at these things is like sometimes we need to either augment, normal pain approaches, or sometimes we need to switch it out. And these things have definitely helped. The joint relief should be really super helpful for your pain. Like if you do it on a regular basis, it should keep it down, but we might need to augment it with something that calms down the sensory nerves. And so, just by themselves, like Tarragon does it, Vetiver can't. Tarragon does it really well. Sometimes we also use sages, like different sages, Spanish sage, regular sage. Spanish sage you can do in a much bigger dosage. But for example, like when somebody's in a chronic fatigue crisis, basically their nerve endings are super, super overactivated. They're firing, 5, 10, 15 times more than normal. And so the nerves are just super irritated and super agitated, and they're firing a lot. And the reason that they fire a lot is because the lymphatic system is congested, and the material in the lymphatic system starts to overstimulate the nerve endings. And so keeping the lymph moving is good, but sometimes you might still need to calm down the nerve endings. And so tarragon, sage, we a lot of times doing therapy, I would take sage and I would make a really strong liniment, like 25, 30 drops per ounce, sometimes even a little bit more. And I'd make it in like a 4-ounce, like little bottle. So that meant, 150, 160 drops in that 4-ounce bottle, which is a lot. And I'd have them shake it up and just like rub it all over their body. And I mean, literally in like 2 hours, it would pull them out of the crisis. I mean, they would just, they would still be a little bit fatigued, but the nerves firing and the overwhelming pain would actually diminish. They would get some rest. And the sage is also very good for strengthening the body and very good for helping to regulate the adrenals. And so it was very strengthening and helped calm down the overexcited sensory nerves. And so I would keep doing the things that you're doing. And, like you said, if you need to get a shot from time to time, that it's there. And if you can maintain it as much as you can, I mean, you should be able to buy a long time without having to do something, drastic with that. You might get away with never having to do anything drastic with it, to be honest. I mean, it really, really depends. But I can't remember, do you run or cycle or anything like that?
No, not on a regular basis, just, it would either be like the treadmill or, one of the elliptical or recumbent bike or something like that.
Right.
You and I are about the same height, and it's like, I'm a little older now. So it's like, no, I'm not going to beat up my body by running.
Yeah. Running's really super hard on the body. I mean, I get it. And I know it's a great workout, but it's so hard on the knees, hips, and back. I mean, it's just so hard on it. And so, yeah, I mean, maybe work swimming in there if you have access. And if not, I mean, you're doing fine as long as the pain and the inflammation doesn't get too bad. I think you're good. And so, always be aware of the spasms because the spasm reduces blood flow into the joint. That's why I keep going back to the spasms is, you're just constantly going to be dealing with that. One of the things we just started playing with, and I'll keep you posted on this, is we actually got a cold laser, and cold lasers are really good for managing inflammation and pain syndromes. They use it a lot with like horses and things like that. And we're looking at different ways of trying to augment treatments for really chronic like health issues, like, pain syndromes. And so, we've only had it for a little short time, but the little bit that we've been using it, the combination of a cold laser and the oils, man, it's a 1-2 punch. We played with a bunch of other modalities. Like I bought an ultrasound machine, like they use in physical therapy. And it was helpful, but I think there's going to be more promise with the cold laser. And so, you know, let me test it for, you know, maybe another few weeks or a month. And if I think that it would be helpful for you, you know, I'll turn you on to the information where we got it, and you can just go direct and get it. And, you know, they have different models and everything, but the way that it's looking now, it would be probably perfect for helping you to manage something like that over a long period of time. You know, it's something where you don't have to take pills, you don't have to get shots, you know, you can just, you start to have a flare up, you just go hit it with the cold laser, or you come back from, you know, exercising, you hit it for 10 minutes with the cold laser, and you know, it would probably be in place of having to take, you know, ibuprofen or something like that. You know, I think we had you on the Wobezymes, correct?
Yeah, Wobezyme and then Solomon Seal. So
So
that was going to
the
be one of my,
Wobezymes, yeah, the Wobezymes will basically work like an ibuprofen. You know, so if you're on Wobezymes, you probably don't need to go down the ibuprofen, except for like in maybe in extreme situations where the pain's really bad. But I mean, you know your body best. But you know, I think if we give you a bunch of tools and you kind of, you know what to do when certain things flare up, you should be able to manage this for like I saw a really bad case of bone on bone, and the person was very active, and she went probably 13 years with it. And you know, I think that had there been some better management, she probably could have even gone a little bit longer. But you know, it was a really bad case of you know, an arthritic hip, and she was able to buy a lot of time, and I mean, really was able to be in very little pain up until the very end, you know, the very end. And the issue was that because, like, here's the other thing, the issue is not wasn't the hip. It was that because the gait, you know, how you walk is a little bit off. She was actually presenting with low back pain in the L2, L3 area because of, you know, the funky walk, and like her hip was a little bit off and the way she would swing her hip. When she went to the doctor, it was actually because of the back pain, and the doctor said, well, you have, you know, no cartilage in your hip, it's that. And she was still pain free in the hip. And so, you know, watch for low back pain. And I would even put some of the joint relief on that low back area just as a compensation, you know, just to make sure like that you're keeping everything good there, you're minimizing any sort of spasm, and it would be more about prevention than everything. And I think you could buy a very long time, if not avoid anything completely.
Just, two things, then I'll move on. So with I'm on Wobezyme in the Solomon Seal, so it's okay to supplement that with the Blue Flag?
Yeah, they would all work. They would all work with each other. In fact, they'll probably make each other like work better.
Okay, and then just kind of a piggyback on your cold laser. I've actually, for one of our dogs who hurt his spine, and myself, we've been using light therapy, and kind of it works. I've been using the green light on him, and then the red light on me on that hip, and it works. It provides relief pretty quickly for, you know, a good amount of time.
Yeah.
So that was it.
So like, you know, like if you the other dynamic is that pay attention to like when you're sleeping, and sometimes laying on your side actually can irritate that joint, because it will sometimes stretch a ligament there, you know, that goes from the top part of the femur, you know, to the pelvis. And so sometimes you might wake up with that. So pay attention if you wake up and you're having a little bit of pain. It has to do with something in your position with your sleep, and then just adjust your sleep position so that you're not letting that. It's usually when the bad hip is up in the air. You know, you're allowing for that hip to come down at an angle. And if it's not resting on the other knee, it might even go down a little bit further and it will start to stretch that ligament. And there's a term for it. I can't remember what it is, but that would be the other thing, that it's not really degenerating the joint, but it will cause you a different kind of pain. And so, you know, the treatments it would be the same. But you're dealing with potential like irritated or stretched ligament, which those respond slower just because they have a really poor blood supply. And if the ligament is irritated for a period of time, it'll just take you a while to shake it off. And so just pay attention, like when you wake up, like, is my hip hurting? You know, and if it is, then just like adjust how you're sleeping. You know, just the next night, you know, just do something different.
Very good, Greg. Thank you very much. I'm so grateful and appreciative for your time and your counsel.
Yeah. So welcome. Keep me posted though. I'm very curious. I'd like to see how things go, especially with your shot.
I will.
Yeah, usually you can buy a bunch of time with the shots. Like the shots will usually buy you. The issue with the shots sometimes is you feel so good you might overdo a little bit.
Yeah.
So just keep that in mind too. Like, you know, you're making up for lost time.
And I'm going to work the blue flag.
One that does that.
I know. You know, hurting yourself. And I'm going to work the blue flag into it also.
Yeah, perfect.
Thank you again, Greg.
Okay, you're so welcome.
When you mentioned the tarragon and sage to calm the sensory nerves, did you say that was a liniment? Did you say?
Yeah, like I think, you know, you could do it in a bath, like the sage or the tarragon, but I like doing the liniment because it dries. It goes a little bit deeper than just putting a massage oil based or lotion based application. And you know, you can put it all over your body, let it dry, and just throw your clothes on and be good to go. And so I would probably do it with sage. Spanish sage would be your best bet. You know, you're using so much sage that regular sage, you know, it has a lot of thulium in it, and you know, you only want to take so much. And so usually I was using Spanish sage, or I was blending them together. And doing 2 sages at once. And so I find that to be a very potent tool in dealing with fibromyalgia, you know, especially when they're in a crisis. And so pain management, one of the blends that we're dealing with for overexcited nerves, I mean, it has tarragon in it, has several kinds of sage, you know, helichrysum, Litsea, cubeba, you know, basil for its antispasmodic properties. And, you know, it's interesting because you put it on and then as a little bit of time goes by, it keeps getting better and better and better because it keeps calming down the sensory nerves. And so it's a little bit of a different approach to pain, because you know what you're doing sometimes is you're re-educating the nerve. And so when you look at, like, when somebody's in a severe like pain syndrome, when it's chronic pain, you know, when you're doing like treatments to try to get the pain, like at some point you're really needing to like break the pain cycle. And that's the thing that's really hard to do sometimes, you know. You know, that's the thing, like if somebody's using, you know, some sort of opioid, like, you know, Vicodin or something, it's okay, but it's really best to only use it for a short amount of time, because after a while, you're going to get a rebound effect and it's going to actually escalate the pain because of what it does to the receptors. But if you use it for a short amount of time and you break the pain cycle, and then you start doing the things that you know how to do to manage the pain, you can actually reduce the pain quite substantially. And so, you know, this thing that we're playing with the sensory nerves, it's to re-educate the nerve so that you break the pain cycle without having to use an opioid or some sort of pharmaceutical to break the pain cycle, you know. And so the idea is to be able to break the pain cycle and then do the management that you can do afterwards. But like when you're in the middle of something that's really like peak levels of pain, you know, it's hard to get long lasting relief until you break out of that cycle. And so, you know, we're trying to come up with ways of doing it without pharmaceuticals so that, you know, people have the ability to control their treatment and be self-sufficient and not be having to utilize pharmaceuticals for every little thing. I mean, pharmaceuticals are good when you need certain things, but you know, pain management, opioids are not a great solution. They're just not great for long-term treatment. And so, you know, it's just been one of those things that over the years, you know, we've all gone down certain rabbit holes for pain management, but we're having to look at pain through different eyes now. And, you know, there's still a lot of different approaches. And we've been going back and looking at very old notes. Like I was looking at a pain formula that's probably 400 or 500 years old. And, you know, going back to when they didn't have all the pharmaceuticals and they had to do something to relieve pain. And so we're trying to come up with new approaches. And so sometimes you go back to the old ways because pharmaceuticals weren't a thing back then. And so, you know, people had to manage those things now. So we're trying to bring all that kind of stuff back to current time because we're almost in the same boat again. So.
Go ahead, Susan.
Hey, Susan.
Hi, Greg. It's so interesting. I live in Austin, by the way, just FYI. Someday you'll come back, but we're not worried about that.
Yeah, we haven't traveled since
Yeah.
Since
Austin. Like Austin and Birmingham are last two places.
You know what? We still like you.
Yeah,
You know, it hasn't changed our affection for you.
Yeah.
So it's interesting you're talking about pain because I am literally sitting on my pain. My right glute, my right little butt cheek is, I don't know what the heck is going on, but it's in a pain cycle. And
Okay. And so let me ask you a couple questions. So when you're sitting in a chair, do you kind of fidget around trying to find a comfortable place to sit? Like you kind of keep.
Yeah. Can't cross my leg.
So,
that's even worse.
So that is a thing called piriformis syndrome. And there's a muscle that goes across your.
I'm very familiar with it. I looked it up. Yes, piriformis syndrome. I've been to a physical therapist for it. I'm actually just texted a dry needling lady but there's some exercises you can do for it, but so I do understand piriformis syndrome. So now I will listen.
So right. So the issue is that piriformis syndrome, the sciatic nerve passes, under that and then passes through a hole in the pelvis. So when that muscle gets tight, it actually pushes the sciatic nerve up against the pelvic bone, and you get kind of an impingement. It's kind of an entrapment, kind of an impingement. And I know I'm splitting hairs there, but impingements are usually a little bit more severe because it involves bone and cartilage putting pressure on the nerve, which is stronger than soft tissue compressing it, which is an entrapment. And so there's a couple of things that you want to address, like putting like the nerve pain blend on that area. That blend is made to calm down the sharp, stabbing pain, radiating pain, electrical feeling, that kind of thing. And then also put it on your low back. The thing with that is it will also, the pain relief neuropathic is made to also help relax the spine and the spinal muscles. And so that in theory should help take some pressure off some of the spinal nerves. Remember to always do something to deepen your breath. So long, slow, deep breaths with like large hyssop, Sitka, something like that. Anytime you have sharp stabbing pain, within a short amount of time, you develop spasms in your bronchioles. And so you start to develop a little bit of a respiratory issue. It's not like you get bronchitis or something, but your breath just starts to become more shallow and rapid, which actually begins to exaggerate that. So a lot of times if you go through and you treat the respiratory issue right off the bat, a lot of times you can chop the pain right in half, like just boom, right in half. Like it'll go from an 8 to like a 4.
And that's with the hyssop and the Sitka?
Yeah, and just long, slow, deep breaths. You don't even have to follow a pattern, just long, slow, deep breaths.
Okay, well,
and then
if
you do that in combination with putting the neuropathic pain relief on, anytime you relax the diaphragm, you're also loosening up the multifidi, the little muscles that run from the different vertebrae. And so that combination of deepening your breath is relaxing the diaphragm, which relaxes the spine. And then the oil topically on the spine and the hip also will relax the spine. That should start to reduce the pressure on the sciatic nerve down in the butt cheek like that. And so you're just going to have to do it for a little while. It's not something that resolves usually super quickly. It's something that's there, and because of wear and tear, or the activities that you're doing through the day, sometimes it can stay irritated for a period of time. But here's the other issue, and I would start taking like quercetin as well, because the issue is there's a few nerves in the body that when they're irritated, they actually increase histamine in your system. Basically they start to cause you to have increased allergic reactions, and the sciatic nerve is one of them. And so if you have any sort of sciatic issue, given a period of time, you're also going to end up with having some sort of allergies, and people usually don't put them together.
Yeah.
But, just treat the allergies so that it doesn't become a thing. And
well, I have quercetin. The very first class I ever took from you, you recommended it. So I listened.
Yeah. Start just taking that every day until the back resolves itself.
Okay.
It's not so much for the back pain. It's just so you don't get another secondary side effect. Because, like you have the back pain, and then if you start having a bunch of allergic reactions, it's just a ton of inflammation in the body. And it just makes it harder for you to bounce back from it as quick. So you're almost kind of treating two separate things, but really they're just two sides of the same coin.
Okay. I have had this for years. So
it's usually not something that just pops up. It's usually a progressive thing.
Okay.
Yeah.
All right. So I don't have any. It's called neuropathic pain relief. I need to buy some.
Yeah, pain relief neuropathic. You can start even if you don't have that right off the bat.
Yeah.
Putting peppermint on the hip and the back is a good place to start, and then just get some of the pain relief. And it's it's a combination of things to. But the mint will have some antispasmodic properties and anti-inflammatory properties, and definitely some pain relieving property to it. So, yeah.
I've been using the roller balls for arthritis and scars. So I just need another roller ball going.
Yeah.
I have my routine. My jars are all lined up.
Right.
With roller balls. So
yeah.
Just know I use them. Thank you.
Well, good.
Okay, thank you, darling.
Keep us posted.
Oh,
so that was the question.
Yeah, it's hard to sit. Thank you.
Yeah.
Okay.
That's the thing with piriformis syndrome, is hard to get comfortable when you're sitting.
It is, and you want to cross your legs, and you say, "No, can't do that."
Yeah.
Oh, you're a darling. Thank you so much.
You're so sweet. Thank you.
That was the question, just to make sure. So neat application, liniment, ointment.
You could do neat as long as your skin can handle it. A lot of times I do it in an ointment. So, if you're measuring it out in an ounce bottle, you could put 25, 30 drops in, which is pretty strong. That's not a massage oil recipe, that's more for an ointment for spot treatment. If you're doing massage, you would do 30 drops for 4 ounces, but 30 drops per ounce. Same if it's alcohol. So, you know, use some form of alcohol or vinegar, put it in there and then rub it on the area. And yeah, that should be helpful. I in this particular case, I lean a little bit more towards the ointment, which is massage oil or lotion. Just because the essential oil is mixing with the fatty oils, you know, the massage oil or the lotion, and it will do like a time release in the area so that the oil stays a little bit more on the site that you're treating rather than hitting the bloodstream and going, you know, other places. It stays really localized in the particular area. You know, the massage oil usually doesn't penetrate the skin quite like the volatile oil. So when you mix them, slowly the volatile oil will separate from the massage oil and keep going into the tissue in and around that area. So it's a way to do a time release treatment in a particular area rather than hitting the bloodstream and just going all over the place. But, you know, neat application would still work. And so, yeah.
Chat question. So Greg mentioned in an earlier class or study group to use joint relief and arthrocare on top of each other.
Yeah, one after the other, not necessarily at the same time, but they do different things. And so, is that one way? Hold on. Too many iPads. So the joint relief and the arthrocare, the joint relief increases circulation and decreases spasms in the joint. Arthrocare is more designed to detoxify that particular joint, especially when there is deposits in the joint. So it is anti-inflammatory, but it helps to remove some of the crystalline deposits and, you know, lactic acid and things that get deposited in the joints, and helps to potentially prevent any sort of spurring or buildup of the material in the joints that can be aggravating to that condition. And so it's best to rotate. I usually start with the joint relief and then complement it a little bit later with arthrocare. So even if you went a couple of weeks treating joint relief, eventually work in the arthrocare, and you could still do them like one in the morning, one at night, or do one and then wait a couple hours and then do the other one. And so I'd always start with the joint relief though. That's always a primary thing for any sort of arthritic condition. Even if it's rheumatoid arthritis, which is autoimmune, you still can treat it with the joint. You know, like when the hands are really curled and things, it'll bring movement back and decrease pain substantially, even in rheumatoid arthritis. And
so someone asked what was in joint relief. Another student posted from their notes what's in joint relief. And then someone was checking, does joint relief still have CADE?
No, I changed the CADE and I went back to Juniper. So,
okay. So for when you're looking at that, instead of CADE, it's Juniper.
Yeah.
Okay. And then what were you referring to when you were talking about breaking a pain cycle? I guess they're not clear on what a pain cycle is.
Like sometimes, you know, like pain can not be constant, it fluctuates. And so what happens over a period of time is somebody gets up where the pain, you know, might be a 2 or a 3 on a scale of 1 to 10, you know, 10 being the worst and 1 being, you know, not very much or none at all. And so they might be a 3 or a 4 for a little while, but then something happens, they get up to a 7, 8 or a 9. And if they're in that for a little bit, it starts to get hard to break out of the cycle of being in that 8 or 9. Like it just wreaks havoc on the body being in that much pain. And so it becomes harder and harder to break out of that cycle of being at a peak pain level. You know, it's hitting the receptors in the brain, your body's reacting, your body's tensing up, you start having changes in your breath, you know, and eventually you will even start to cause like some endocrine issues, For example, if you're in pain for a long period of time, the adrenals kick in, there's just all kinds of things that start to happen. And so it becomes hard to break that cycle and get it back down to that, 3 or 4, where you can try to manage it there. And so part of the issue is the sensory nerves become highly, highly overactivated. They start firing at a much more rapid rate. And even though you might reduce the causes of the pain might go away, but the sensory nerves are still firing at a very rapid rate. And so this is tied to a thing that you would call the righting reflex. And it's just a thing in the body where when the nervous system goes down a particular rabbit hole and it has a behavior for a period of time, it just becomes the new way that it functions. And so what happens is the sensory nerves will fire more intensely for a period of time. And then when you remove all the contributing factors, it just says, your body says, this is the new us. The sensory nerves are just going to fire fast like this all the time. And so you see things like chronic fatigue syndrome, fibromyalgia, that is what's happening. The sensory nerves are firing way more than normal, way, way, way more. And they don't really have, like if you look, there's not a lot of inflammation in the area where it's being generated. They don't have physical cause that is normal. And so with that, you basically have to re-educate that sensory nerve to go back to the way it behaved prior. Like your body doesn't go, okay, the incident is over, let's go back to our normal way of functioning. The body just keeps adapting and just goes, yeah, this is the new us. Like we fire off, 10 or 15 times the normal rate, as far as sensory nerves goes. And that's just the way we're going to be from now. And so you really have to actually re-educate the nervous system to go back to normal function. And so this is what you would call neurological regeneration. It's not growing nerves together, it's actually re-educating nerves. There's different kinds of re-education, different kinds of regeneration. One is to stimulate blood to go into the area, which brings, oxygen, nutrients, and hydrates the tissue, and that is a form of regeneration that accelerates the healing process for a particular area. And then neurological regeneration is actually to go through and re-educate the nervous system for it to go back to proper ways of functioning that was before the health issue or the incident, whatever it be, an injury or a degeneration, you keep re-educating it so that it goes back to its original way of functioning, and that is breaking the pain cycle. You're basically re-educating the nerves. So in like neuromuscular therapies, for example, what you would do is you would compress something, you hold it from anywhere from 3 to 10 seconds, and then you gently let up. And that action of pushing and then releasing, be it your thumb or your palm, that actually can re-educate the nerve somewhat. But the issue is that it might be all over your body, or it might be too deep for pressure to, be able to re-educate that. And so, one of the ways we look at it is trying to go through and re-educate it with things that manually calm down the sensory nerves. So things like sage, things like tarragon, Litsea, cubeba. Helichrysum does it to some extent. Sage and tarragon much better at calming the sensory nerves.
So we don't know if this then would be, but they asked, what product to break pain cycles do you have?
We're about to release a prototype that's called Nerve Help. I don't know, I just came up with a simple name, but I was going to call it Nerve Regeneration, but Nerve Help just seems to be easier. I don't know that we've put it on the site yet. We've been playing with a prototype for a while, And so we can put that on, we'll do it tonight. And it's to help redo the pain, the overexcited nerves. And then there was another one that we were looking at that called Threshold. That one actually is for stretching the pain threshold for both physical pain and psychological pain. Again, it's another one that we've been playing with. That one also seems to reduce fear. And one of the things that Samantha says when she uses it, she goes, when I smell this, I feel empowered. Like I feel like I could go out and just kick butt and take names and, just get a bunch of stuff done. And, that's the component that's the psychological pain, because, it makes you not as sensitive and reactive. And so, it's, we'll put the two on the site in the next couple of days. We've been playing with prototypes for a while, but usually I like to play with the prototypes before I release them to you guys. Sometimes the blends, I blend them like Splendor's probably the most extreme. I blended that 19 different ways before I released it to you guys. So like, I usually like to work the bugs out before you guys get it.
Go ahead, Cindy.
Hey, Cindy.
Hi, how are you?
Hey, how's Florida?
Hot and muggy. Same as every day in the last year. Have you ever done anything with infoceuticals? I've been playing with those, and
no. What is that?
Well, basically, it's charging water with the imprint or the electromagnetic signals of other substances.
I've heard of it. I have some peers who are doing some stuff like that and doing some testing with it, but I've never played with it myself.
Okay, because I've just been playing with it.
Is it working or?
Yeah. Well, actually, the reason I thought of it is I made some seaweed, some gel with essential oils in it for a friend of mine who has a degenerative neurological disease and has restless leg syndrome all night long. And I took a lot of the pain management and calming oils, and then I added an infoceutical to the gel and the oils, and it was the first time in years that she slept through the night.
Oh,
so
wow. Interesting.
I think it is charging or increasing the effectiveness. I don't know.
Okay, I'll look into it.
I just thought you might have some experience with it and see what you were doing.
I know of a facility out in Southern California who's been testing it with different ways of scanning the body, and they basically go through and run it through a bunch of tests, scientific tests to go through and validate things. And I know they've been playing with it for a while, but it's been a little while since I talked with them, and so I don't know whatever came of it. But the last time I talked with them, they were right in the middle of examining that technology.
Yeah, I seem to have better luck with the pain management when I you combine the two, the oils, and so the problem, I don't have access to a diagnostic.
Right. Yeah, I'll reach out to them. I'll see. That's probably I might even actually be seeing those people here in a couple of weeks. So yeah.
Oh, great.
Yeah.
All right. Have a great night.
Yeah. Thank you.
For the blue flag, is there a preference, either capsule or liquid extract?
I would get the capsules. I think the capsules work a little bit better. And the issue that I have with the tinctures is, you know, we here had bought a couple of different tinctures from some different companies, and you know, not everybody makes tinctures to the same strength. And we got a couple of tinctures, and they really didn't put a lot of herb material in it when they made it. And so they were not very strong. And so the capsules are pretty consistent. And I would say, I think Herb Farm makes a tincture of Blue Flag, or at least they used to a long time ago. They're pretty solid, but some of the other companies, it would depend on who it is. So I would just go with the capsules, to be honest with you. I've always used capsules when it comes to that and lobelia. So yeah, they're both pretty solid.
A couple people asked me what the name of the two new oils were, so I just.
Yeah, Threshold and Nerve Help, and yeah, we have about, I don't know, about 15 things that are in development. But you know, trying to augment things for sleep, for pain, for immune system. One of the things too is there's been some new studies, you know, with the COVID thing about how to protect the lungs. And so we also have a blend coming out based on a study of essential oils for protecting the respiratory tract, called respiratory protection. And it's just based on, you know, there's this chemical in some essential oils called bornyl acetate. And like rosemary verbenin is actually the proper name is rosemary verbenin bornyl acetate. And so there are several oils that have very high levels of bornyl acetate. And so they were tested to see if it helped protect lung tissue with the viral infections and things. And it has shown to be of help. And so we're putting that out. It's something that you could put in your mask, you know, if you're still having to wear a mask some places, but otherwise you can just inhale it, put it on your wrist, and, you know, inhale it from time to time. We've been just carrying it around in a bottle or putting a few drops on the chest right here so that it always kind of goes up into the respiratory tract. And so yeah, that's been very helpful. Yeah, that study came out a couple months ago. Okay.
I think we have about 12 minutes for
about 12 minutes. I mean, I don't know if we can get into a protocol. Anybody else have a question or something? Let's maybe cover another question or two, or.
See what pops up.
If not, we'll do a little short protocol. Okay, let's do this. If you have, let's try to use like tarragon or maybe a sage, Litsea cubeba, vetiver. Let's see, what else do they have in that? Let me look one more thing up here.
Basil.
Rosemary verbenin. We could do basil or helichrysum. Everybody good with that, or do we need a substitute? Or?
Just a quick question. Do you have that respiratory protection product available?
We'll post it on the site. I've made a whole bunch of it. We just haven't posted it on the site. And the good thing too is it's not a pricey one. You know, it's very reasonable.
I think we're okay.
Okay, so let's go ahead and just have you notice how your body feels. You know, notice your joints, your pain level. Begin inhaling. Your awareness is on your feet, just the top of the feet, the bottom of your feet, your whole foot. Move your awareness to the lower leg between the knee and the ankle. Your knees. You're inhaling with your awareness on your knees. And then your upper legs, so your thighs, the front, the sides, and the back of your legs. Your whole upper thigh. Keep inhaling with your awareness on the upper thigh. And then your hips, the front, sides, and back, also the floor of the pelvis, your whole hip area. Your low back and your low abdomen. Your whole abdominal cavity. And then your mid-back area. your chest and your upper back. The tops of your shoulders, your armpits. Your upper arms, from the shoulder down to the elbow. The elbow down to the fingertips. Your neck, the front, the sides, and the back of your neck. Your jaws. Your whole head. Now, if there's a part of your body that is causing you pain, irritation, or is compromised, degenerating a little bit, take long, slow, deep breaths and put your awareness on the compromised area. Okay, see how you feel. you can continue to do this, especially on the compromised area, and it should bring you some relief. We are going to jump now into the Angel study group. So thank you guys for joining us tonight. I love you guys, and join us for the Angel study group on the different link, or hope to see you on the weekend. So if not, I'll see you next week. Take care.
And I just posted that Angel one up on the thing just now for you guys, and hope to see you in just a moment.
Yeah, everybody's invited. So even if you haven't had Angel classes, you're invited.
And it is in that newsletter where you got this link as well. Have a good one, guys.
Thank you.